Getting on the map, getting on the radar screen. I think people in healthcare generally and elsewhere are aware of it. I think still the vast majority have no idea what it is, how it works, why it's a good thing. But I think it has, it preceded the development of patient-centered care, and kind of helped to form, and I've seen this happen, I work in the VA, and I've seen this happen in a couple of places where integrated care was well enough established that when the patient-centered medical home started being rolled out a couple of years ago, it actually formed around the integrated care program.
I think one of the greatest things about the integrated care movement is that it has pushed our field to bring evidence-based treatments into more palatable formats. So, we have a really nice, rich history of developing this armamentarium of evidence-based treatments, but they really aren't very well utilized. And by making us think about how to get them into a population health model, I think it's really forced us to think about how to make them more usable.
So I think there's been lots of important accomplishments. One of late, I think important, is being able to really have us be integrated into the primary care medical home. I think that's been a very significant accomplishment of not just having health conditions, but having mental health be a central component or core component of the PCMH. And that, I think, has opened up the door for a lot of programs who are kind of moving towards current patient care to make sure that that mental health or behavioral health component is integrated into it.
I think the most important accomplishment of the integrated care movement has been just the spread of it. I remember 10 years ago that very few people, integrated care was about a committed few, and now that's the buzzword everywhere you go, that it's really become, I think, an accepted way of thinking about innovation and where healthcare needs to go next.